The World Health Organization has determined the outbreak of the novel coronavirus 2019 to be a public health emergency of international concern on January 30, 2020. In facing this urgent infectious disease outbreak, the government of PRC implemented large-scale interventions, such as sealing of Wuhan, a city of 11 million people, and establishing 13 Fangcang hospitals to centralize and quarantine confirmed and highly suspected patients in China. All suspected patients who have mild or no symptoms are suggested to self-quarantine at home. To ensure the enforcement of self-quarantine, most businesses are asked to shut down and give their staff indefinite holidays with salaries by the central government. Although these large-scale quarantine interventions aim to effectively and efficiently contain the spread of the virus, they may potentially harm people's mental health conditions. For example, in a cross-sectional study during the 2003 SARS outbreak, Laura et al. Found that in Canada, among people who are being quarantined, 29% of them had shown symptoms of post-trauma stress disorder, and 31% had shown depression. On the other hand, according to Professor Xiang from Psychiatry Department of the University of Macau, in an outbreak of a highly transmissible virus, such as this coronavirus, people tend to fear the virus itself, and evidence suggests that fear will lead to varieties of mental health illness, such as anxiety disorder and depression. Therefore, there is a big need to address confirmed and suspected patients' mental health conditions during this outbreak of the coronavirus in China. Considering the mental health side effects of quarantine and people's fear towards this novel virus, the National Health Commission of China released a notification of basic principles for emergency psychological crisis interventions for the outbreak on January 26, 2020. The guideline provided key treatment points for different potential groups, including confirmed and suspected patients, healthcare providers, people who had close contacts with patients, people who refused to seek medical treatment, susceptible groups, and the general public. However, although the guideline covered a range of target population, as of February 4th, Xiang et al. Stated in their paper on Lancet that mental health care for patients and suspects whom are directly affected by the epidemic has been under-addressed. In response to this case, Professor Duan and Zhu from the Department of Psychiatry at the First Affiliated Hospital of China Medical University explained in their paper on Lancet that the main reasons for such disparity are the shortage of licensed mental health professionals and the inadequate preparedness of psychological crisis intervention. In the guideline, it states that key medical personnel for treatment should be a licensed psychiatrist. But by the end of 2017, there are in total only 3,400 licensed psychiatrists in China. That's approximately 2.41 per 10,000 population. The number is just too few to meet the needs. Therefore, it is urgent to train more professionals for potential hazards and outbreaks in the future. But in the current situation, task-shifting approach should be adopted because a nurse-led program has shown significant improvement of patients' mental health conditions during the Ebola virus outbreak in 2015. Furthermore, according to Dr. Duan and Zhu, there is no authoritative organization to deploy and plan psychological crisis intervention at the central governmental level, which makes the most local medical departments work on their own. This leads to bad cooperation in major outbreaks, which could cause poor follow-up and late diagnosis on patients. The government should consider forming a directing organization and adopting a more systematic approach to better prepare and allocate mental health professionals. For example, Dr. Zhang and his colleagues from Medical Health Center of West China Hospital at Sichuan University designed new models and tools for psychological crisis intervention specifically for the coronavirus outbreak, which properly utilize online applications to better connect patients, mental health professionals, and physicians. Besides these things that the government should do, there are many things that a normal person can do to maintain good mental health during this outbreak. As a public health worker, I have summarized 3 tips that aim to help improve people's mental health conditions during this outbreak. Firstly, only look at reputable sources on the outbreak, because rumors and speculations are easy to cause and worsen anxiety. Recently, there are many non-evidence-based articles posted on different Chinese social platforms, such as WeChat and Weibo. Some posts wrote about government conspiracy theories, which claimed that the virus were made by some labs or organizations, while some other posts wrote about fake treatments for the virus, such as drinking a lot of alcohol, or claiming some OTC medications to be an amazing cure for the virus. These posts seemed persuasive by their dramatic style of writing and drawing proofs from non-scientific sources, but none of them is supported by peer-reviewed literature. Secondly, stay connected. It is important to stay connected with families and friends during this outbreak of the coronavirus. Due to lockdown and quarantine interventions, many people are separated from their families and friends. Outbreak et al. Found that the loneliness and boredom can increase the stress and the risk of getting mental health problems, while having a strong social support is essential in maintaining one's both physical and social mental health. Therefore, it is always important to talk to our friends, neighbors, and family members through the phone and engage in relaxing physical activities such as yoga and Pilates if you are being quarantined or being detained at another city by the lockdown. Finally, do not make assumptions. According to the health stigma and discrimination framework, during a period of an outbreak, such as the SARS outbreak, the MERS outbreak, or this coronavirus outbreak, due to the fear of infection, fear of economic and social ramification, stereotypes, and etc., people tend to jump to conclusions about who is responsible for causing a disease, thus causing stigma and discrimination. For example, domestically, in some cities, people blame the Wuhan citizens for eating bats and causing the disease. Internationally, in some countries, residents from PRC were discriminated against and treated to be the cause of the spread. However, such actions will not help in controlling the spread of the disease, but only intensify conflicts among ethnicities. Furthermore, these conflicts and discrimination will lead to depression, anxiety, and other types of mental health problems. Therefore, it is important for everyone to remember that the virus can affect anyone, regardless of his ethnicities. Only being caring and supportive can improve the chances of prevention and recovery. For example, as part of the global response, a lot of NGOs, foundations, businesses, celebrities, and scientists are caring and making every effort to help relieve the virus. The Gates Foundation donated $100 million to support. Scientists around the world are working day and night to develop vaccines. These are all parts of the global social support and will improve patients' mental health conditions. Remember, even your simple verbal support will help someone who is suffering from mental health illness due to the outbreak. In conclusion, addressing patients and suspects' mental health conditions is a really important aspect of controlling an outbreak. The Chinese government should train more professionals for future incidents, adopt task-shifting approach, and use a systematic framework to address the need of increasing mental health illness during the outbreak. And the individuals should only look at reputable sources on the outbreak, stay connected, and not make assumptions to maintain a good mental health condition. Furthermore, these tips are not limited to only China, but can also be generalized to most developing countries, where mental health is being generally overlooked when facing infectious disease outbreaks. Thank you.